Here we go. So we were having a little difficulty getting started here with Facebook. So we are going to instead go ahead and record this and then post that. And then Justine's going to go ahead and put the link to this webinar so that people can join this way. So if you are here for the TAP Talk, we really appreciate the opportunity to spend some time with you today. Our talk today is very special in multiple ways. For me, it's very special because it is my last TAP Talk. Friday is my last day here at TAP, and it's such a gift to end the week on such a positive, healthy, motivating note as with my friend, colleague, and former TAP client, Dr. Jenni Shafer. So I'm going to go right ahead and allow Jenni to introduce herself, to share her screen, share a little bit about rehab counseling, and then please go ahead and throw questions in the Q&A or in the chat. I'll be monitoring that, and I'll be able to share with everybody some of the questions that we can talk about after, some discussion questions. And we will also have this again available recorded for playback as soon as it gets downloaded from Zoom, which is usually fairly quick. So I want to welcome you, Jenni, to our TAP Talk. TAP Talks are a way of introducing you to resources and amazing people and things that affect your journey of aphasia, whether it be from stroke, traumatic brain injury, primary progressive aphasia, brain tumors, whatever it is. So I think you'll all really love listening to Jenni today and hear her story. So welcome, Jenni.
Thank you. I'm so excited to be here on the other end.
On the other end, indeed.
I think as I get set up here before I get started, I do want to say thank you, Maura, because, I'll go into a little bit about myself as we get going, but Maura has been here for me from day one. And she was someone who, as someone with aphasia, diagnosed 10 years ago at this point, was one of the first people, apart from my speech language therapist, to really give me some hope that things could get better. So I really can't say thank you enough. And I know you're going to make as big of an impact in your new role. So thank you.
Thank you, Jenni. We have these values for a reason, right?
Yeah, so I love to talk with you guys about how to address and acknowledge the impact of aphasia, and then how a rehab counselor can be a part of that process. So I think, I love having the chance to talk about rehab counseling. It's something that I feel like, it's been around for a long time, but I think when people usually think about rehab counselor, they think about a vocational rehab counselor, someone who works in voc rehab. And I'm here to kind of illuminate the other roles that a rehab counselor can have in recovery, especially for someone with aphasia. So I'll talk a little about me. So I think that's important, right? This talk is not about me, but I think that it's important to understand kind of your own lens and how you approach different topics. So how I approach rehab counseling is from the perspective of a researcher and also someone who has had aphasia and apraxia of speech. So, how I see someone with aphasia and work with them might be a little bit different than, someone else who has had a different experience. So I do think it's important to kind of acknowledge how we go into each kind of situation. And then we'll talk about the actual psychosocial impact of aphasia on both the people with aphasia and then their caregivers or their family members and their loved ones. We'll talk about rehab counseling, like I said, how it differs from other types of counseling, I know that's a question I think Maura might might ask later. And then how specifically can rehab counselors address, the consequences of having aphasia? But as I go through my slides, I'd love it, please feel free to ask questions, type them up, raise your hand, whatever. I'm not sure if people on the call can actually talk during the call or if that's muted, but either way, it's totally fine with me. So I'll give you a little background about me. Maura shared, that I've been a client of TAP. I studied rehab counseling and psychology at UNCE, and I'm a certified rehab counselor, and I'll go into what that means a little bit later in the slides. In 2013, I was actually working in clinical research, and I had a traumatic brain injury. So when I woke up at the hospital, I noticed that I could understand what people were saying to me, but I was also very confused because I wasn't able to, verbalize a response. I wasn't able to put together any kind of speech. I wasn't able to talk at all. So I learned that I had aphasia and I had apraxia of speech. And I, went full force into intensive speech therapy. I did that for about a year and I was able to return to work and research. But the seeds have been planted that there were a lot of facets of their recovery process for me that could have been improved. I felt like I've always said, the hospital and the healthcare staff did an excellent job kind of with that medical piece, helping me kind of get back to my daily life. But I felt like I wanted someone who can understand what I've been through, someone who could address kind of that impact on my mental health and other aspects of my life that had been affected by this injury. So in 2016, I went back to UNC for my doctorate in speech and hearing. I chose to focus on aphasia and acquired communication disorders, and did my doctorate actually on caregivers for people with aphasia. So I kind of, I had that lived experience of being someone with a communication disorder. And I saw how that also affected, my family and the people who loved me, and what they went through. And so I wanted to learn more about how to help families. So now I'm a postdoc at UNC. I just can't get away from UNC. That probably pains you more.
Yeah, it really does. Well, after Duke beat Clemson yesterday, I'm really very, very good with Duke right now.
You're feeling happy about that.
Right.
But I mean, I love UNC, and so the program on integrative medicine, we actually, it's a neat kind of marriage, I think, for me, of my experience in rehab counseling and then my speech research, because we do a lot of integrative healthcare, and looking into better ways to support people via things like mindfulness, for example. That can be another talk.
Yes, I was going to say, I've already got your book, just put you down here.
Yeah, we've done a really interesting study on using mindfulness to help alleviate stress in dementia caregivers. So I'm very supportive of that. So I'm also in the process of opening a private rehab counseling practice, just to, focus my passion on helping people with aphasia and their families. So we'll get into the really important part of this talk. I know anyone who is a client of TAP or has an experience with someone with aphasia, it's clear, right, what the psychosocial impact of aphasia is, but I think it's important to kind of break it down a little bit. So it's hard to pinpoint exactly the number of people who have aphasia. I mean, you can see it's a big gap there, 2 to 4 million people. But then you have almost 200,000 people acquiring aphasia each year, which is quite a high number. And again, usually from stroke or brain injury like I had. Aphasia, affecting, again, receptive or expressive language is something that we know, again, if you're part of TAP, but I think again, we like to, as a researcher, we'd like to categorize and organize things, and have neat labels for, the type of aphasia. But in reality, it's usually both things that are affected. Our brain doesn't have firm boundary lines, within it, where if you have a stroke, it's the damage to your brain, or a TBI, the brain injury is not always going to stay within that neat little boundary of, what constitutes receptive or expressive aphasia. So I think that's important to acknowledge that, most people with aphasia have both. And then what exactly is psychosocial? That's the title of this presentation, and something that you probably hear a lot. But I think it's important, again, to kind of delineate what it is. It's anything, like any kind of social factor that can influence a person's thoughts and feelings and how they behave. So I use isolation here as a good example of a social factor that can influence someone's mental health and how they feel. And we know that aphasia can be extremely isolating. We'll talk about on the next slide kind of why that is, but language is such an important integral part of being a human. I think we talk, talking to someone is like the first thing we think about, right? But we use language and speech in so many other ways that, it's hard to quantify. We make slides for a presentation, we write an email, we send a text, we read the text, we read a card, we go through the drive-through, we order food at the drive-through. I remember that was one of the first things I was able to do when I went back to work, and I was so excited about that, and it's such a basic thing that people do every day. But when you have that ability taken away from you, it's extremely frustrating and it's extremely isolating. And that can be a big risk factor for people with aphasia, becoming depressed, for example, or, developing anxiety. And that plays into, other factors like your self-esteem, right? If you can't go and, order something for yourself, you might feel like you're not independent, and that can be a big blow to someone's self-esteem and their identity. And we'll talk about how aphasia and caring for someone with aphasia can also affect, caregivers and their identity as well. But again, it really impacts your confidence when something you've maybe taken for granted your whole life is impacted in such a big way. Not to mention your occupation. So, stroke and TBI doesn't just happen to people who are retired, right? We know this. I mean, we've seen teenagers and people in their 20s and 30s, have accidents or have stroke. And working is a big part of someone's life. We spend a lot of time doing it. We make our occupation, helps us, pay the bills, but also provides a sense of meaning and purpose to someone's life. And so when that is impacted by aphasia, again, that's extremely upsetting. And then, of course, aphasia impacts the relationships and as we just talked about, other activities of daily living. Are any questions so far?
Not yet. I'm gonna keep the question thing open. So if you guys do have questions as we go along, feel free to throw them in. We don't have to wait till the end of the presentation. So if you have a question or a thought, put it in and I'll just reinforce that. So you can keep
Yeah, I
going.
guess I'm curious if there's anyone attending who, has aphasia.
I believe there are definitely people in the waiting room here or in the here in our audience that do have aphasia. There's also some providers, which I
Mhm,
also think is important
mhm,
besides, yep, there's somebody saying yes now. Not just people who have aphasia or someone they love has aphasia, but
mhm.
also they provide services to people with aphasia. So they are getting this information so that they'll be better in that provider role as well.
Yeah. Yeah, and I just asked that because, I think it's like I'm not the expert, right? I'm someone who has expertise in what I'm doing, but I'm not the expert on someone's life. And so, I'm completely open to, feedback, and if there's anything that someone with aphasia, well, we're going to talk about providers and family members and caregivers. But if there's something that someone with aphasia, would like to point out that's important here that I might have missed too, I appreciate that. So we'll go to the impact on caregivers. And that's something that I, am pretty passionate about as well, having done my dissertation on caregiver support. So everything that we had just talked about, all the ways that aphasia impacts the person who actually has the disorder, also impacts their caregiver. And I say caregiver, is kind of a broad term. It can be a friend, it can be a loved one, it can be a spouse, a sibling. Um, it doesn't have to be someone who's necessarily living with you or providing care, 24/7. But I think of caregivers, as anyone who has a role kind of in your life. And so, obviously some of these impacts are gonna be more of an issue for someone who does provide more care. But I think it's important to keep in mind that aphasia impacts an entire network, right, of people. So, um, the providers here on the meeting understand that aphasia impacts how a caregiver communicates with healthcare providers. Um, I met with a lot of caregivers in those initial stages of, the stroke or brain injury. And they've, expressed how confusing and frustrating it can be to talk with healthcare providers in the hospital, for example, when their loved one can't be the one communicating how they feel and how they're doing. And then that communication extends to other like basic things like scheduling appointments, like maintaining household, issues. I highlighted kind of carrying the burden of communication, and maybe that's not the best way to put it, but I think it's important that wrapped up in that statement is kind of that idea that oftentimes while this is going on, there's also like this big role shift that
Yeah.
the caregiver is having to deal with, right? I mean, anyone who's, loved someone who's had a stroke, for example, knows that, things are hard enough to deal with as it is, trying to process this kind of traumatic event that's happened. And then on top of that, when aphasia um, is a factor. You're having to kind of figure out how best to communicate with that person yourself, and then kind of with them and for them at times. We talk about not talking over someone or, trying to, um, we want to keep them involved in making decisions and communicating. but especially I think in those initial stages, there's a lot of trying to figure out how to do that. And that can be really stressful and really hard. And then of course you've got, other consequences, let's say of a stroke where someone might have mobility issues. And so you're dealing with, not only that language impairment, but you're dealing with, how best to get the person bathed, how to get them dressed for the day, where to go for lunch or go grocery shopping. And again, with that role shift, it could be that someone is taking on these new responsibilities that they've not had to do before, and that tends to happen more, in situations where someone is married, for example, and, they're taking on roles that maybe they weren't doing before, maybe that was something their spouse did, for example. I heard a lot of feedback from caregivers when I was doing my dissertation. They've never had to deal with kind of keeping up with the household finances, and now they're doing it because their loved one can't, manage that part of, daily living. So it's a big change. So, that goes, this goes without being said, that I think, again, it's difficult and hard enough to kind of deal with the consequences of stroke or brain injury. I haven't really addressed, someone who has aphasia as a result of like a progressive disease. And that can be obviously equally hard. But it's a little different to what someone who's got, say dementia or primary progressive aphasia. And so it's not surprising, I think, that caregivers are more likely to experience depression. We talked about how having aphasia can be really isolating for the person with aphasia. Well, what happens to their caregiver? Let's say that their spouse has had a stroke and has aphasia, and they're not they're isolated and they're not going out anymore. What happens to their spouse? They're likely also feeling isolated. They are not probably doing the things that they enjoy doing as much, at least not initially. And so that's hard to adjust to. So one thing that I looked at quite a lot when I was working on my dissertation was this idea of third-party disability. And so it's this idea that, the person with aphasia, if we think of aphasia as a disability, right, and that could be, we can talk about that later, but this idea that just for now, just
Yeah, I
bear
don't want to
with
argue with you.
that, the consequences of that, affect the caregiver so much that they have, what is considered third-party disability. So that they are at, higher risk of anxiety, higher risk of depression, and all those great things that come along with.
Right.
Any questions so far?
Now, I think we're going to keep going, and then we'll have questions because
Okay.
then we'll have our two screens
Okay.
but this does remind me of the work of our colleague, Dr. Jackson,
Yes.
how he, talked about the what he found to be that the caregivers were experiencing the same type of levels of depression as an impact as people with aphasia too. So that there's certainly enough support for this type of work. So I'm so glad you brought that up.
I remember interviewing one person who actually had to go to the hospital and get treatment. She was just so physically depleted. She was a spouse of someone who had a stroke and who had pretty severe aphasia. And she really, as many caregivers do, put his needs above her own. And, we can talk about that too, but, and that's something that is completely understandable, but she did it to the point where she was just exhausted and she needed, outside help to kind of get back to a healthier state. And so I think about her a lot.
Yeah, it also reminds me of one of our group leaders and her own private practice of iCommunicare, Abby Simon, talks about care partner as being a part of the person, not your entire self. And I think that that's one of the things that we could all talk about is how we identify people who are providing support, love, guidance, care for people with aphasia, because the other issue is I don't think that people always access resources because they don't believe that they fit into that category. I've told you this before, that when my mom had her stroke, I didn't consider myself a caregiver, so I didn't look up resources for caregivers because I was a daughter and it was my duty, my honor, my role to do that. It wasn't a whole new, identity. And I think that that's one of the things is really just what are we calling it and how does it represent? Because if you want people to find those resources, they have to be able to identify with the term,
Right.
So, yeah.
And like I said, with this woman in particular, she didn't think that she she wasn't focused on herself,
Yeah.
right? Like you said, and I think that's totally understandable. It's just, I think we have to have a better way, like you said, of reaching these people. And we've all, well, I think a lot of people have heard that expression, like you can't pour from an empty cup, right?
Yeah.
So,
Yeah.
but it's hard to put that into practice. And I think maybe that's where rehab counseling can come into play as well.
Absolutely.
So I'm sorry, this is not all that aphasia friendly. I'm happy to redo the slide, when I can post it. But I said earlier that I'm a certified rehab counselor, and we'll get into kind of how rehab counseling differs from other forms of counseling. That rehab counseling is a national certification that you can get after going through a master's program, like the one that I did at UNC. And I said earlier, before I went to school, I thought, of vocational counselors, so someone who might just work for voc rehab and help someone who has a disability, acquire and keep a job. And rehab counselors do that. And that's a very important piece. But one thing that I pulled out here from the scope of practice is something that we don't tend to think about, which is that we are certified and capable of giving individual and group counseling. And it focuses on kind of that psychosocial impact of disability. So again, we think of aphasia, if we think of it as a disability, or at least something that can be, limiting to some degree. We are able to counsel people, and that's within our scope of practice. So it's not quite the same as, North Carolina has another type of counseling, licensed clinical mental health counseling, which is a mouthful. And don't ask me to give you the acronym because I can never get it right. So that's residual impact for me. But, that's, so someone who does licensed clinical mental health counseling can say, they are doing, psychology, and they are addressing specific mental health concerns, versus a rehab counselor that can say, I am And again, kind of like aphasia, right? I think some of these things kind of bleed over, right? So rehab counseling can address the impact of the disability. And you can do that with a mental health counselor as well. But I think the big difference there is that rehab counselors are specifically trained for different types of disability. So we get training on aphasia, we get training on stroke, we get training on apraxia. I remember talking about apraxia in my program years ago, thinking that it sounded like, a cool, like heavy metal band name, but
Probably is.
which is hilarious considering that I would get it. But so, we get specialized training in different types of disabilities that, a mental health counselor might focus more on kind of just the psychology of certain things. Same thing, like a psychiatrist obviously is very different, where again, they focus on the more kind of medical piece, and they can do talk counseling, talk therapy, with people, but they are obviously they have a medical degree, they have a license, they can give, prescriptions and diagnoses that someone with a rehab counselor certification or mental health counseling is not able to do. Again, I'm sorry, not completely aphasia friendly, but I wanted to kind of go over what else is within the scope or practice for rehab counseling, because I think that's important. It's important to kind of delineate, why I see a rehab counselor versus a different type of counselor, and how they can help kind of address the impact of aphasia. We obviously, the things that I've starred here, if you can see that, oops, let me go back, are ways that are things within the scope or practice that I felt like could specifically address, people with aphasia. So we obviously are not the ones who are going to diagnose aphasia. That's your speech language pathologist or your doctor, but we can we can collaborate with other providers and say, okay, you have this diagnosis, how's that going to, potentially impact your life? What do you like to do? Do you have a job? What do you value in life? What gives you meaning? What gives you purpose? And we can take that and we can start planning for ways to, obviously, let's say that we're talking about someone who is still in active rehab. The goal is always to make improvements in your speech and your language. But the rehab counselor is able to kind of work around that and say, okay, I'm going to meet you where you are right now and help you figure out ways to live better with what you have going on with aphasia, and we'll readjust and set new goals as we need to as you get better. If you're someone who has had aphasia for many, many years, we know that improvements can still be made. But maybe you are kind of at a different point in your life, and maybe you're not working anymore, but you would like to, make some more meaningful connections with people. You want to maybe volunteer, you want to, again, find some different meaning or purpose in your life. That's something that, working with a rehab counselor can help with. So I think I'm coming to the end of the slides here. One thing that I really focused on in my own research was this idea of informational support for families and caregivers of people with aphasia. And that was what that means is that people need information, right? When someone has a stroke, or a brain injury. It's a scary transition for everyone. And feeling like you're in the dark about something is frightening. And I think that the more information you have, the more education you have about aphasia, about the stroke, this is what stroke is, this is what happened, this is how you can try to prevent it from happening again in the future. This is, ways that you can, your speech language pathologist, will give you aphasia education about, how to get better. But having that support, I think, is key to kind of dealing with that transition and finding your way forward in rehab. And then once you're past that kind of acute rehab stage, maybe your needs change and you want more information about, are there community resources like TAP? Are there support groups? Are there other ways that I can be, living a life that I want to live with aphasia? And I think that rehab counselors can play a pretty big role in helping to provide some of that support to people and their families. So I'll just reiterate that, rehab counseling is not, it's not strictly mental health counseling, right? It's more holistic. I think about that in that way. And that, we're not doing speech therapy, but, ideally they should be collaborating with the SLP or your other healthcare providers to kind of, again, come up with a holistic kind of plan. And I think that's the last slide.
Okay. So let's stop sharing. Is your very last slide have your contact information?
You know what? That would have been a good thing to do. I don't have that, but I can.
We will go ahead and add that to the discussion, but I'm gonna stop the sharing then. And so putting us back here together as on this call will allow you all to put in some questions under the Q&A or in the chat box. Comments, questions, considerations for Jenni. I do have some thoughts as well and some inquiries too. Leanna just said such inspiring work. Thank you for
Thank you.
sharing. Stick around, we got more. So I'm gonna just kind of go back from the beginning, and you talked a little bit about the lens and how everybody sees things differently based on their own lived experience. We had a gentleman come in today who his wife was involved in TAP years and years and years, one of our first clients. And he said, everybody kept coming in and talking about her aphasia. And he finally said, she has some trouble thinking of the words she wants to say, get them out, but it had never really tied together that that's what aphasia means. And I think that your emphasis on education throughout the journey and repetitive, like you've heard that once before, but here's it in a different way, and here's it now applying to this stage in your journey. And often and redundant and explanatory. So I just didn't know if you had any comments about what you see as like good education along the journey, and how for providers we can monitor that, and how for care partners and for clients, what to ask for.
I like the redundant comment, because that was basically the whole focus of my dissertation, right? Was kind of this idea of giving this information, but like repeating it in different stages, because how you're doing 3 days after someone has a stroke is going to be worlds apart from how you're doing 6 months or a year later, when you've had time to process everything, and maybe now you need different information. And so one thing that a lot of the SLPs that I talked with said that they do is kind of teach back, which I like that. I like the idea of giving someone information and then saying, tell me what you know about this, or, tell me what you already know. So you kind of, again, this idea of meeting someone where they are, you get a better idea of, okay, they're overwhelmed. They don't know much about aphasia. I need to clarify again what this is. And doing that, through every time, just to make sure that that they're really getting it.
Yeah, I love that too. I love that idea that your, perspective changes as your life experiences change.
Mhm.
And I think oftentimes we do this kind of thing of pre-injury, post-injury, pre-aphasia, post-aphasia. But in reality, our lives are always changing. Whether
Mhm.
we have had an event or not, there's other events that are going on in life. So you don't press pause on all the other changes. Getting married, getting divorced, having children, having grandchildren. You can't put a pause on that.
Mhm.
Instead, you have to weave them into your rehabilitation. So if you're in the middle of your rehab, I know, one of our starting clients is just amazing. He very soon after his stroke, his parent passed away. And so it wasn't just about him dealing with the aftermath of a stroke and aphasia, but how then does that weave into his parent passing away and then wanting to do the talk at that person's funeral? And that's a new goal, right? So I think that weaving piece into every stage, and as you get better and take on new challenges and find new purpose, you're able to then find out what help you need then. I think that's where rehab counseling would be amazing.
Mhm. I think that's the key, that kind of differentiates rehab counseling from a different, kind of profession, is that, they have the training, like in how to kind of weave, again, like dealing with your disability into what you want to be doing in your life. But what you said sort of reminds me of, you know, pre-aphasia for me.
Mhm.
My dad had a stroke in 2012, and I've had a lot of like formal education, but man, it was a very confusing time. And, I really I was interacting with multiple healthcare providers every day, and I was in the hospital for hours every day, and I was still so confused about what was actually happening and like what was his prognosis. And it wasn't until, another doctor sat me down and like showed me, like went through, his CAT scan and like said, these are like the parts of his brain that are damaged, and this is what this means, and this is what I would do, and I'm not you, but, and that was like the most helpful thing anyone could have done for me, is just to sit down and really walk through things. And maybe it was just that I had heard this information for 10 other people, and then he finally kind of clicked in my
Right,
brain.
right.
But that's just a good example, I think, of why it's so important to keep repeating this information to people. And I was the one, I was asking for it, I knew what to ask for. And a lot of the time, I think people are so overwhelmed that they don't know what to ask for. Like you said before, like you don't know what you don't know. And so,
What I love about what you're saying too is that many people know that this is, we all know that it affects the person and affects their care partners and people that love them. We know this. This is why we have 3 service divisions as part of TAP. What we do through TAP, through going to a counselor, to going to your, whether it's a rehab counselor, a mental health counselor, psychologist, psychiatrist, your speech therapist, whoever it is, a coach that you're going to, you are empowering people in your message of ask for and advocate for. There is a generational shift happening where people are like, I want to know, where, maybe my parents' generation really didn't. They said, well, this doctor told me, so I'm going ahead and doing what he says. And I think that empowerment is huge. And I hope those people that are watching, whether they're watching the recording or watching live, understand that this is not someone else's journey. It's your journey. And so you have to be able to ask questions. And if you need help, these are the people that help you. So I love that. I think that must feel really good to be empowering people.
You know yourself better than, anyone else. And so you're right. Like, I think it can be intimidating sometimes, especially in the early stages, when you have, again, like 15 people coming in and out of a room, like giving you information.
With all new vocabulary, by the way, that you've never
Right.
heard
But
before.
learning to do that, and learning to advocate is so critical. And I think you could probably do an entirely separate talk on that.
So, Sandra, thanks for joining, and it's nice to see your name here. So Sandra was saying my father had his stroke in 2021, and he's now 85, a very young, dapper 85, I must say. I notice how he has gotten older, slower, and don't know if it's due to the aphasia symptoms shifting or his age or possible complications. How does this correlate, or how do we tell the difference between things that are kind of natural aging and then consequences of stroke, or who do we ask about that?
I think that if there, well, let me preface this. I think if there, concerns about if there's any physical or medical concern, I would bring that first to the doctor, obviously. Because you're right. I think it can be difficult. 85 can mar, I mean, I think this person. I don't know this person, but
Oh, I thought you were saying because I was 85.
no. No. But you know what? I've learned too that 85 on one person can look different from another person. And so without knowing this person is hurt.
Right, sure.
But and without knowing kind of the severity of the aphasia as well. But I think it can certainly, like, when you are having language issues, for example, then you might appear like you're slower, or like you're having to think about what you want to get out or what you want to say. This is why we have the whole discussion about this is a language issue, not intellect, right? So
Right.
I think there certainly can be some consequences of the aphasia at play there, but it's hard without knowing other factors. But
And I would also say that this is very indicative of a very astute, caring daughter, or caregiver or care partner, which, I have to brag, TAP has a lot of, our majority is. And one of the things that I always suggest, and I think fits into this, is how do you collaborate and how do you ask doctor stuff if you don't kind of keep track somehow of the information? And I know you are a beautiful writer, Jenni, and a blogger. And I mean, I really have so much respect for your writing ability, but it reminds me to journal. It reminds me along my mom's journey, how I would kind of keep track of things like, hey, this is what's going on, instead of waiting till you get to the doctor and go, well, he has been a little more this or that. You have tracking, you have, I'm a big one for timelines, big one for timeline. Draw a big old line on a piece of paper in your patient folder that you bring to every doctor's appointment, where it has all the medications, it has all the information, and then note what are some of the circumstances around what happened around that time. So, I think that speaks volumes about you, Sandra, and about the quality of caregivers that, that are here asking questions.
I think that's a great point too, the timeline, because I would say let's say that if he appears, older and slower, immediately post stroke and aphasia diagnosis, that's normal. If, there's a significant change, since then that would be more of a concern for me. Because then I would wonder, is there something else going on? So that's a good point.
Yeah, I mean, a stroke itself is a medical event, so it does take a lot out, and it can be one of those teetering times.
Mhm.
Again, I have some questions, but please, like Sandra did, just add into the chat. Or if you have a comment, please go ahead and do that. I'm monitoring them. So if I see my little red dot go up, I'll check in and read that. I wanted to go back to your idea that counselors don't, like a rehab counselor is not going to work in a silo. They are going to connect and collaborate. So what does collaboration mean to you in the rehab process, both either personally and or professionally?
I think, well, I think they're intertwined, right? The personal and
Right.
the professional,
Mhm.
for me, it's hard to kind of take one without the other. But for me, that means if I'm doing my job as a counselor, I should be collaborating and working with, you know, the speech language pathologist. I want to know, um, like, how severe is this aphasia? Tell me a little bit more about the stroke. What kind of stroke was it? When did it happen? You know, to get that kind of important background information that you need to kind of um, start your treatment planning. And then if there are other concerns, if there are other providers that they're seeing, are they seeing physical therapy or occupational therapy? How can we work together on that? What I think that goes down to what their goals are,
Yeah.
and when I ask that, I mean, what are the person's goals? Because they might differ very much from what's formally written, in their medical chart. So what were they doing before the stroke? Were they working? Were they retired? Are they married? Are they in relationship? Um, and I get that information from the providers. I get it from the person with aphasia. I get it from their family. And I think you need all of those things to really
Yeah.
come up with like a comprehensive plan for counseling.
Sandra was saying, I see him as if he is competing to stay relevant with regards to my mom, and he goes out for errands and shopping with her, but feels he's hurried and having to struggle to kind of keep up. It's
Mhm.
a double-edged sword for him to do and not do. Um, by doing, he gets out and keeps busy, but without it, he'll sit in front of the TV or the computer. Wow, nailing the idea of social isolation. And
Mhm.
it's fascinating to me to realize that this position that I'm leaving my other child of TAP for is one that I had me start TAP because of. So the National Aphasia Association years ago said that they did some research and found that 92% of people with aphasia consider themselves socially isolated. And that was so shocking to me that I was like, I'm going to do everything in my personal professional power to reduce that rate. But at that time, it really was focused on the person. And I just really appreciate that the family seeing it as what's all going into the family system. So, and I
Mhm.
think you as a counselor take that all into account, correct?
Mhm. I think it's understanding that isolation isn't just caused by one thing, right? It's
Yeah.
not like, oh, this person had a stroke, they're going to be isolated automatically. It's the fact that, there's so many other factors at play. It's, what were they like before? Did they have access to getting out and around? I mean, I worked with one woman who I just think so highly of, and she was like the most social person when I was in her house talking with her, but she wasn't able to get out by herself. She was
Right.
dependent on her family members to come and take her places. And because her aphasia was so severe, it was very hard for her to, pick up the phone and talk or text someone. And so here you have someone who is incredibly social and like wants to make meaningful connections, but wasn't able to do that.
Yeah.
So there are so many different factors at play to think about, how someone becomes isolated. Or it could be that, I remember feeling when I was first recovering embarrassed, and I felt really silly for feeling that way because I had worked with people with speech disorders through therapeutic horseback riding for many years. And I never would have judged them for how they sounded. And
Right.
here I was going out in public trying to order food, feeling embarrassed about how I sounded.
Yeah.
And so that was a big awakening, but that can play into,
I was just gonna say that kind of brings you right back to, self-confident, like one of your
Mhm.
first slides, how it
Right.
affects
So
how you feel about yourself.
if you're not confident and you've kind of had your identity shattered, to some degree, maybe you don't want to go out.
Right.
And so there's just so many different things to consider.
So I'm going to kind of wrap it up since it's just about 7:30, but I'm going to wrap it up with my advice first on this, given all the stuff you told. And so from the speech pathology and TAP perspective, um, talk to your therapist, your speech therapist, about what barriers exist. Keep records and keep notes and journal about what barriers exist so that there could be compensatory strategies and rehabilitation strategies that could work together with. And then I'm going to pass it on to Jenni by saying, don't be afraid to get help, not just for you, but for the person with aphasia, but also for the care partners. There are people in multiple venues of support out there for you, and maybe one type of therapist wouldn't work for you, but another one would. I'd love if you could kind of finish it off with, like, how do people seek help and what should they do?
Now, I do want to piggyback on what you said about, sometimes like finding a good counselor is like dating, right? Like
Hardly
it
remember
can be
that.
unpleasant sometimes. You've got to go through a couple of different counselors sometimes to find a good match. And I wouldn't let that turn you off to finding that match, because there are people out there who, um, you know, understand. I think it's maybe I'm a little different because I've had that kind of personal experience, but there
Yeah.
are other counselors out there who get it, and
Mhm.
who, could be a good match for working with someone with aphasia or their family. But I'm happy to like compile some resources to share to you. I should have done that for the slide, but
No, go
uh,
ahead and we'll add it to the summary and to the video.
yeah. So, I mean, in terms of rehab counseling, there's the rehab counseling website that I shared earlier with the scope for practice. There are, you can look up certified counselors in your area. That's a great way to start. I know UNC offers rehab counseling as well, as part of their outpatient program. I'm just thinking about Dr. Blaze
Yeah.
Morrison, who you connected
Mhm.
with. I'm doing
Yeah.
some really interesting work, but let me do a slide. I'll put one together and then we can share that as well.
That'd be great. That'd be great. And I'm gonna stop the recording here as I say goodbye to Jen.